Okay, so now we're going to talk a little bit about food safety. This is something that we may be in a position to teach patients and families. First of all, food storage, some general guidelines. Fresh meat and fish can stay in the refrigerator for 1 to 2 days once they're thawed. Dairy, usually up to about 5 days. If it's cheese, probably 3 to 4 weeks, especially hard cheeses. Softer cheeses tend to go bad sooner. Eggs, 3 weeks refrigerated, but if they're hard boiled, only 1 week. Fruits and vegetables can last 3 to 5 days. Be aware of expiration dates and teach patients to be aware of expiration dates, but also teach patients to be able to identify signs of food spoilage. For food handling, and this may be even more important, patients need to know, you need to know, everyone needs to know, wash hands and surfaces before handling foods, and foods that are served fresh need to be handled separately from foods that must be cooked to be safe. So using the same cutting board for raw meat and for vegetables, not a great idea because bacteria can get into those cutting boards and then infect that fresh produce. For food preparation, we need to make sure that patients know to cook meats and eggs to the proper temperature. So, you know, we're kind of thinking about food poisoning. The most common type of food implicated in food poisoning outbreaks is fresh produce. So fresh produce should be washed when it comes into the house or before it's used. Another thing we need to look at for food safety, though, is aspiration risk. If we have a patient, whether that's a child or maybe someone who's had a stroke or who has decreased diminished mental capacity, we want to think about things that are choking hazards or aspiration risk. Food allergies, we need to make sure that we teach patients with food allergies and their families how to identify that allergen in food. We also need to teach about cross-contamination. I have an egg allergy. If I go to a store that makes sandwiches, if they cut a sandwich that has mayonnaise on it, and then they use the same knife to cut my sandwich, I can have a reaction to that. And a lot of people are not aware of that cross-contamination piece. So we need to teach people about cross-contamination. And then we need to teach people how to manage those reactions. What do they do if there's a reaction? We also need to teach patients about interactions with medications. There are quite a few foods that may decrease the absorption of certain medications or medications that may decrease the absorption of certain nutrients. There are foods that alter the way medications act. In particular, a lot of foods, or a lot of medications are toxicities possible if the person is drinking grapefruit juice. Okay, that's something that sometimes we forget to teach. We also need to make sure patients understand meds that can cause gastric irritation, and those meds should be taken with some kind of food. All right, the next section is also going to be short. It's going to be about cultural considerations in nutrition.